Hi, everyone. My name is Dr. Paul, and I'm a board certified dermatologist practicing in Orange County, California. I'm thrilled to be a part of taking control of your diabetes. And today I'd like to talk about the skin manifestations of diabetes. So the title of my talk is The Fungus Among Us and Other Skin Conditions. But basically, I want to talk to you about the skin manifestations of diabetes. So diabetes can affect the skin at any point along its course. Signs of skin involvement could suggest undiagnosed diabetes or even prediabetes, or even just very poorly controlled diabetes requiring adjustment of treatment. Here is an outline of the common skin manifestations of diabetes that I would like to talk about. So the most common skin conditions that you see are dry, itchy skin, or even skin tags and fungal infections. And then there are some relatively uncommon conditions that I just want to present so you're aware of what they are, such as neuropathic pressure ulcers, or diabetic dermopathy, bolus diabeticorum, sclerodema, necrobiosis lipoedica, eruptive xanthoma. Trust me, I'm not trying to throw all these medical terminologies at you, but just trying to say that there are a lot of relatively uncommon skin manifestations that can tell just us by looking at it that a patient might be having diabetes. So the first and most common thing we see is very dry, itchy skin. This is super common among diabetics, and it can happen even if your blood sugar is well controlled, or can also be a sign that the blood sugar is really, really high. The most common thing to do to control this is to take better control of your diabetes. And then the second most important thing is to moisturize your skin. Thicker creams or even ointments are preferred over lotion because lotions are water-based, whereas creams and ointments are oil-based, and they provide a better barrier for the skin. We recommend petroleum jellies such as Vaseline or Aquaphor, or even companies such as Vanicream or CeraVe that make really moisturizing creams. Other exfoliating creams with lactic acid or urea in it, such as amlactin, which is available over the counter, is very helpful because that unclogs and exfoliates the pores and causes increased skin turnover, again, helping with the dryness on the skin. It is important to avoid hot showers, even though people love going in and taking a hot shower, but that actually dries out your skin. So we always recommend a short 5-minute lukewarm shower instead. And then always it's recommended to use very mild soap and body wash, such as Dove. Second, I want to talk about this very, very common growth that we see in patients. These are called skin tags, and they're usually harmless. They're very common along the neck, the armpit, or even the groin. And if a patient comes in with way too many skin tags, then I do start to think, is there any possibility that they have an underlying diabetes that they might not be aware of? And I'll probably go in and check a hemoglobin A1C. Or if the patient already has a known diagnosis of diabetes, then it might be a sign that the diabetes is not very well controlled. So in terms of treatment or removing it, there are a few different ways we can do the procedure in our clinic, whether we do snip excisions and cut them out, or we treat them with liquid nitrogen. But again, typically it's not necessary unless the skin tags are itchy, painful, or bothersome to the patient. And even for it to be covered by medical insurance, typically they have to be irritated, or otherwise insurance companies might look at it as more of a cosmetic thing. Next, I want to talk about fungal infections, which are actually quite common among diabetics. So the first one is candidiasis, or yeast infection in the mouth, body fold, or even the private areas. So they look like these white color, like a white layer inside your mouth, on your tongue, or in your body fold below the breast. You might have this really reddish, almost macerated appearing patch. And in terms of treatment, again, it's an indication that maybe we need to do better with the control of diabetes and blood sugar. And then other things to do is if it's on the body fold, you can keep the area dry, and you can try antifungal creams and powders. There are some over-the-counter ones, such as nystatin powder or Lotrimin, that help some people. And when it's not enough, then you can see a dermatologist for prescription antifungal creams, or even an oral medication, depending on how severe it is. Next, this is athlete's foot. which is pretty common. So they appear as scaly, very itchy rash on the feet and in between the toes. Again, some people are very bothered by it because of the itching, but some people might just be like, oh, there is all this redness going on. So treatment, again, number one is to keep the area dry. And number two, you can always get started with over-the-counter antifungal creams such as Lotrimal or even Lamisil. And when that's not enough, you might need to see a physician to get prescription antifungal cream or even sometimes prescription oral medication for some severe cases. Next, super, super common, we see a lot toenail fungus, which is more prevalent in diabetics. So usually it's limited to the nails. And this is an important point that I like to emphasize because a lot of times some of our patients might be worried that what if it spreads? But toenail fungus is typically very limited to the toenails or just nails in general and does not spread via your blood or any other parts of your skin either. So in some way, it's reassuring that other than the cosmetic aspect of it, it's nothing very worrisome. Treatment can actually be very challenging. The best treatment we have is oral prescription medication called terbinafine, which is typically a 3-month course. And even with that, the success rate is about 60% or so. And also sometimes we need to do monitoring of your blood to look at your liver because it could possibly affect the liver. Other common treatment includes topical antifungals, though to be honest, they don't really work as well. There's like a topical gel that people can apply on their toenails, but you have to have realistic expectation. Mostly I actually tell people that keep your nails short, keep them clean. And for women, they can sometimes just paint over their toenails and that's not going to make it worse. Next is this condition called Acanthosis nigricans. So you have people usually have these velvety brown patches in the creases of their neck, armpit, or even groin area. And Acanthosis nigricans might actually be the very first sign that someone might have diabetes. So in terms of treatment, again, you have to have realistic expectation because it can be very challenging to treat it. Most important is to improve insulin resistance and get the diabetes under control. And then on top of that, you can try over-the-counter ammonium lactate products such as amlactin, or sometimes even prescription medications such as topical retinoids. Next, I want to talk about neuropathic pressure ulcers, also known as diabetic ulcers, which happen at pressure sites, most commonly on the sole of the foot. They're usually painless, and they happen as a result of poor circulation and nerve damage from uncontrolled diabetes for a long period of time. Now, and this is one of the reasons why we actually emphasize and tell our patients with diabetes to kind of examine their skin, look at their feet from time to time to look for these ulcers, especially if they're early on starting to develop the ulcer, because you don't really feel the pain, sometimes it goes unnoticed. And in terms of treatment, we always say that for these wounds, it's important to seek medical care as soon as you can, because otherwise they can get infected, they can spread and get much bigger. So immediate medical care is always recommended. And then again, going back to the basics and taking good control of the diabetes and the blood sugar. Next, there's this condition called diabetic dermopathy, also known as shin spots. So they are these small red-brown patches on the shins, and they happen due to minor trauma or just slow healing because of the circulation problem. They're nothing worrisome per se. They're not cancerous. They're not infectious, but they are more, again, suggestive that someone might have diabetes. Next, bullous diabeticorum. So these are these very painless blisters that can happen either on the lower extremity where it's more common, but sometimes even on the upper extremity. Usually they heal on their own in 2 to 4 weeks. And in terms of treatment, it's just supportive care that's recommended. And another important concept I want to highlight in dermatology, whenever we take care of patients with any of their skin problem, if anyone has a burn or blister or any sort of injury, we almost always recommend not to pop them, not to pop the blister, but to let it heal on its own, because the top layer of the skin acts as a natural Band-Aid and allows your skin to heal. And then if you use things such as hydrogen peroxide, or even neosporin or triple antibiotic, a lot of time that can actually irritate the skin and even cause allergic reactions. So the best thing to do is to just keep the area clean and then put simple Vaseline on it, because Vaseline or petroleum jelly has the least amount of ingredient in it that can irritate the skin. Even Aquaphor, which is another ointment that some people like, that has lanolin in it that can irritate the skin. So Vaseline is the safest and by far our most recommended product for the skin to heal on its own. Next condition I want to talk about is sclerodema. So this is when people present with very hard, thick, and swollen looking skin on the upper back or even the neck area. Treatment can be limited, but number one, again, to go back and take care of the diabetes, the blood sugar, get it under control. And then a lot of time it's just symptom management, getting the itching under control. If they are itchy, a lot of time it's not itchy. And then sometimes the thickening of the skin can happen on the fingers or on the toes, or involving the skin over a joint. If that's the case, sometimes it can affect the mobility of the area, and then physical therapy might be needed in that case. Another quite rare condition is necrobiosis lipoedica, where you see these yellow, reddish, or brown patches with a very shiny porcelain-like appearance on the shin. You can even see the tiny blood vessels on it. 30% with necrobiosis lipoedica patients have diabetes, but only 0.3% of diabetics have NLD. What that means is if we see this clinical finding on someone, it is highly suggestive that they might have diabetes, and we do a workup to rule that out. But not all diabetics have this condition. Next is another pretty rare condition called eruptive xanthoma, where there's this sudden outbreak of small reddish yellow bumps pretty much throughout the body. And again, usually it's a sign of very poorly controlled diabetes with high triglycerides. Treatment, again, symptomatic management. If there is any underlying itching or symptoms, then it's getting that under control, and then better control of the diabetes. So those were the main conditions, skin conditions that we see with diabetes. And my key takeaways from this talk is that diabetes can cause many skin problems. And most of those skin problems are actually harmless. But some skin conditions can be suggestive of either undiagnosed diabetes or even poorly controlled diabetes. Many skin conditions in diabetes are preventable with good glucose control and also with careful treatment of the skin. And then for dry, itchy skin, it's best to moisturize, moisturize, moisturize. If there is one main key takeaway you can get from this talk, is that if you think your skin's itchy, go ahead and moisturize, because most often or most commonly we see that itchy skin is because of very dry skin. So moisturize, moisturize, moisturize with thicker cream or ointment rather than lotion, and that will help significantly. And then when in doubt, it might be best to see a dermatologist to help recognize any skin problem due to diabetes and also to help manage them. So thank you so much again. Hopefully I was able to share something that's new, and hopefully you learned something new. If you have any other questions, please let us know. You can reach out to me through my email, which is drspauldderm@gmail.com. So drspauldderm@gmail.com. And I hope you have a nice day. Take care.